You've heard it said, just follow the protocol. And EMDR therapy may be taught as a simple protocolized intervention. However, such guidance is completely and utterly insufficient for working with complex trauma. One of the things that my mentor, friend and colleague, Dr. Mark Dworkin, had outlined was in his book, EMDR and the Relational Imperative, that there is an essential element, and that is the interpersonal. The interpersonal dynamic is vitally important, and the more complex the case, the more important your therapeutic alliance is, because you're creating an energetic container within which to do the work. Again, Uri Bergman, a colleague who's written extensively about how neurobiology relates to psychotherapy and EMDR in particular, Uri has always talked about the importance of the interpersonal neurobiology. And I heard Uri talking about this long before we heard luminaries like Alan Shore, Jaak Panksepp, and others begin to talk about this. A lot of the focus has been internally what is happening to our own neurobiology, but actually what is really more important is what is happening in the interpersonal neurobiology, because there are two neurobiological processes in the room, the client's and yours. So the importance of the interpersonal space is really vital. Tom Burns, who is a psychiatrist working in the UK, in his book, EMDR Unnecessary Shadow, talks about all mental illness has a common thread. It happens in the space between people. So working with trauma, and in particular complex trauma, Mark in his book reminds us that we need to function at a level that is constantly aware of what is happening between both of us, and that building a safe container where the person feels able to be present and where we as the therapist can be fully present with them is vitally important. So paying attention to what is activated within you as we are listening and responding to the patient. My teacher and mentor in terms of working with complex dissociative cases, Remy Aquarone, Remy advised me that at times whenever a person who is deeply dissociated can't articulate what's going on in regards to their emotions, that we actually may be tuning into that as a therapist. And so why they can't find the voice, the narrative to describe their emotions, we may be able to say, I'm picking up a lot of anger. I'm wondering if what you're experiencing at the moment could be anger. And this is a way for the therapist, for example, to be able to utilize that interpersonal connection to enter fully into that healing space with the client. And this is something that we'll focus on in detail in regards to the supervision that we provide for complex cases, and indeed in our complex cases workshops.